Charlotte, you want to talk about what you were
Well,
in the break room?
Nancy and I had a conversation back when we were in the break room that we have had some positive experiences with billing insurances for school services delivered on school campus. There are two insurance companies primarily that have typically paid systematically, and that's Aetna and United States Behavioral Health Care. And especially EAPs, if you were signed up on EAP panels, the EAPs are very interested in keeping parents on their jobs. And if you can make a case for mom can stay at work if I can see money at school, that's more acceptable to them. And do you want to say some other, whatever you found?
I really haven't had that much experience with it, and I'm not the one that deals with it, but I do know that we have had payments from those two companies, and one actually paid on case management services, and I know the place of service code is on the bill that we send, so.
And I've never had any paper case management, so I'm really glad that some of them are opening up to look at that. But that place of service is negotiable if you can tie it to how this can improve the family functioning, or however you can justify it to make a case for it. So don't give up on the insurance.
I'm wondering if at one of our meetings that we need to have insurance at the table when we get to that place, because that's one of our topics, is talking about that drift between Medicaid and private insurance, and also the law. But if you remember, we talked about too the idea of you have to have some kind of a bill generated to either Medicare or Medicaid for them to kick in, and you have to bill some party. We're trying not to bill families for services provided at school, and basically those two laws are sometimes in askew of each other.
Well, I had a question regarding that. Is this are you with a particular school that's billing the insurance, or are you with an agency serving a school that's billing the insurance?
I billed the insurance when I was in private practice.
Right.
I'm with the state now.
Right.
Division back.
Well, I'm just curious how, I don't know, I wonder if that's a glitch.
And I don't know if you're off-site, if you're an agency going in, it may be different than if you're a school
You're a school,
employee.
I see.
They still buck at it if you're an agency. They still buck
Yeah,
at it,
and
because we bill for a youth home, and I have a therapist on the school campus, and they've still given us a hard time trying to.
Well, I think if we can get, like, I don't know if the insurance commissioner, you mentioned Jay Bradford, but somebody at the table when we're ready to move forward with that would be really helpful, because that's another system of care piece, to be able to provide services on the front end, so that and what the benefit to them is if we're doing this on the front end, it cuts down on what they're paying for on the back end.
Right.
And I think, and that's.
And I agree that the insurance companies will bulk at you, but you can negotiate.
Well, those two, Charlotte, we just sent the bill in and they sent payment, so we didn't even have to negotiate with them at all.
And this was when you were at Baptist, or
Right, yeah.
right
just
now?
A couple months ago.
Interesting. But those are some topics we need to definitely look
I
at.
think ours has been trying to get my new therapist, my new school-based therapist, as a provider for certain insurance companies if they're not already, is the
Right.
problem that we've had.
And that is a problem, and that's a little time consuming.
Yes.
Yeah, and that's the thing about getting everybody on a provider network piece, which is, it is time consuming, but once you have that, and you just, what I generally do is I just blanket them all, it's the same pretty much format, and then having your NPI number, which is your National Provider Identification Number, basically, where they can check things out online when you first go through credentialing. Those make it really easy whenever you move around too, because you're always going to have that attached to you as a provider. Any questions or feedback about today's presentations that we want to note into the minutes for Rhonda, or anything, or comments? I'd like to say that I think we want Hot Springs at some point to come present to us. I don't know when that might happen, but I want to put that out there, that we make sure that we get them. Any other comments or questions? Or
I would like to say there are some flyers back here on the table that were put out for the PBIS conference that's tomorrow. Through System of Care monies, we were able to fund, I believe, 15 scholarships, but we have struggled because folks are out of school. School personnel are not in school situations. So if you have anybody, we have 13 still.
Openings.
13. And, you know, it's in Jonesboro, and partly that's, you know, maybe the travel and that piece of some of it. But yeah, if you have anybody that you know of, we need to hook them up today.
Ruth, I have a question. Did I understand you to mention at the System of Care Commission meeting last week that this presentation would be available to view on the web via stream?
I think to present, Dawn,
Yes, we're actually having this recorded, and so then we'll be able to put it on the web or be able to burn copies for people to view.
How will we access it? Through the System of Care website?
Yeah, it'll be through the System Care website. It'll be on that SharePoint site.
great. I just want to thank all the presenters. The data you're presenting is awesome. I mean, I think, and that's what I've always preached to my schools. If you can show people how this affects time, cost, outcomes, then you sell the program. It sells itself, basically. So that's to put a plug in for research, and I think I'm pretty excited about the YOQ. And as our school-based programs get up and running, we're going to be included in that. So I think that we're going to really have a big push for data and outcomes to really help us promote what we're all doing collectively to the state legislators at some point to say this is how we're saving dollars in children's mental health, and we need more of these programs, and we need more funding for them, because I think that's a big thing. It keeps us spinning our wheels, is that we don't have it on the front end where it really can be cost effective. Do we have our next meeting date? And I guess the other thing that I brought up at the last meeting, and I don't know where we are with this, but we also want to get this on the record. We have a lot of work before us, and even though there's not many of us as far as membership here today, I think we really need to look at, are we going to meet more than once a month? Because there's a lot of work to be done and a lot of things to address. So keeping that in mind, we want to think about that for our next meeting to decide if we're going to commit more time to this project. 'Cause I'm thinking that if we want anything to go before the legislators, it's going to be a very interesting session because of the cuts, the funding cuts. But I think we also got to stay on their radar in order to make an impact whenever it is the time is right for us to come forward with whatever suggestions we do. As far as our next date,
We'll send it out after the meeting today.
okay. Anything else?
I would just ask that we still try to keep it on Monday,
Oh, yeah,
so
Mondays,
we
I
don't
think
change days or anything.
Monday will probably be today,
And I
Yeah.
appreciate, Ruth, I appreciate you stepping in and facilitating today.
certainly.
Thank you very much.
Thank you all for coming.
And I want to thank you for letting me attend from afar.
Oh,
How far?
I'm sorry.
Harrison, Betsy's all the way up in Harrison.
We weren't
I'm getting rain, Betsy, send some here.
Didn't listen.
I have no idea. I haven't looked outside in several hours, so I couldn't tell you.
all right, well, take care.
Usually the fourth Monday.
Okay, thank you.
Bye-bye.
Right, that on the third Monday, you've got that big hot springs deal coming up.